Hello, good evening, everyone. Today we are going to discuss the case note of Miss Sophia Austin. So she is suffering with polycystic kidney disease. And this letter is written to Dr. Matthew Nathan, a nephrologist at City Hospital, for further management of Mrs. Sophia's condition and asked to be notified about the outcome. Now, address the letter to Dr. Matthew Nathan, nephrologist, City Hospital, Newtown. So I repeat. So the patient name is Sophia Austin, and she has polycystic kidney disease. The letter is written to nephrologist for further management of Mrs. Sophia and asked to be notified about the outcome. So that's it. Let us go back and see the condition. This letter is a bit complicated for many of the candidates, but actually there is nothing to do. It appears to be complex, but actually it is not. Now, a 46-year-old woman presents to the emergency department where you work as a nurse with a 2-day history of right-sided loin pain and macroscopic hematuria. The pain is continuous and dull in character. Now, I have the background information. So background information says that the patient presented to the emergency department and she is 46 years old. Now, she had pain in her loin, right side loin, and she reported that it persisted for the past 2 days. Now, the type of pain was continuous and it was dull. Now, she also reported that there was macroscopic hematuria, in the sense visible blood in the urine. So let us go ahead with the patient details. The name, full name, Miss Sophia Austin, date of birth. Now we have a lot of family history that we are not going to concentrate on this thing. We have a lot of things there because we are writing to a nephrologist about her polycystic kidney disease. We are not going to write about her kidney, about her siblings, children. No, we are not going to do all these things. We have, it appears that her father's brother has had kidney transplant due to polycystic kidney disease. This appears to be an important matter there. But we can write the same thing in another way in the answer. So we don't need that. So I am not selecting anything from social history or family history just because it is not so relevant in the particular condition. So let us go with what happened today. So today, that's 1st of March 2021, she presented to the emergency department with dull continuous loin pain, that the right-sided loin pain, which she reported persisted 2 days. Okay, so this was the background information. Now she's febrile. She doesn't have any fever. Her pulse is regular, but you know that her blood pressure is abnormal and her diastolic pressure is over 100. So this is something which is not very crucial here in this particular condition. So no, her other vitals are normal. Now, we don't have any cardiovascular respiratory distress or something like that. Now we have another particular thing here in palpation of her abdomen is ballotable masses in each flank. So both flanks we have ballotable masses. It shows that what this ballotable masses shows that's a problem with the kidney, maybe kidney cancer or polycystic kidney disease or something else. So some problems with the kidney there. So we have got some information there. Now, right-sided mass is tender to palpation. So this is not so important, but if you want to write, you can write. Percussion knot is resonant over the masses, no problem. Now, neurological examination normal. So we don't have any other issues there. Now let's go with the investigations. We have a lot of investigations. Hemoglobin is slightly higher, but it falls within the range. 14.3, it falls well within the range, no problem there. White blood cells, okay. Platelets, okay. Sodium, okay. Potassium, okay. But urea and creatinine is high, so you need to write that normal urea and creatinine there. Albumin falls in normal range. Urine analysis, we have presence of protein and blood. Urine microscopy is also there. So we have the abdominal X-ray and no intra-abdominal calcification seen. So we have very special things here: urea, creatinine, and blood and protein presence in the urine. So that's all we have. Still, we have not confirmed the diagnosis. Now we have the assessment going on. So we have the family history. The pattern of inheritance in this family is consistent with an autosomal dominant trait. So that is something. We have palatable masses. We have high BP, that is diastolic BP higher. Now we have a urea and creatinine higher. So we have to confirm the diagnosis. We performed an ultrasound abdomen. So where we found multiple cysts or black areas surrounded by thickened walls on both kidneys. So to confirm polycystic kidney disease, there should be at least 3 renal cysts with at least 1 cyst in each kidney. So we have multiple cysts in both kidneys. We have confirmed it is polycystic kidney disease. So the confirmation is made there. Now we have our plan. The first one is to refer to the nephrologist that we are writing the letter. Needs to have effective blood pressure control within the diastolic pressure. Now we are doing that just in the emergency department, but we are transferring the care to the nephrologist. So it is his responsibility to make the patient aware that this is something alarming. So he needs to take measures to control the diastolic pressure, as well as the patient has to take initiative there. Now, the clinical trials are starting of vasopressin receptor antagonists, which show promise at inhibiting cyst growth. So we started vasopressin receptor antagonist. So this is to inhibit the cyst growth. So that's a trial basis. So that's all we have here in this. It's a bit complicated. It appears to be. Yes, it is. Now, 1st March 2021, we have Dr. Matthew Nathan, nephrologist, City Hospital, Newtown. Dear Dr. Nathan, reference Miss Sophia Austin. It was written Miss and Mrs. So some part it is written Miss and some parts written Mrs. So I selected Mrs. because in the writing task we have Mrs. That's the reason why I selected the title as Mrs. So whatever is seen in the writing task, you have to follow that. So that's the reason why I've selected Mrs. instead of Miss. So no worries there. Miss Sophia Austin, who is expected to undergo renal replacement therapy secondary to polycystic kidney disease, requires your long-term follow-up care. Now I can make this thing better because this is a bit, very, very thick and very tightly arranged purpose paragraph. So most of you candidates don't understand what exactly it is. So why we have written renal replacement therapy, all these things. There will be questions after questions. So you better rearrange the matter the matter, the patient's name, the diagnosis, and the requirement in another manner. So the way which we have arranged here is somewhat confusing. So it is better to rearrange the purpose in a better way. So anyway, it's somewhere similar. Now, today, Mrs. Austin presented with continuous dull pain on her right loin, which she reported persistent for the past 2 days. So this was today's condition. So she presented with dull pain on her right loin, which she reported persistent for the past 2 days. So that's the report we have selected. The most important thing, that is pain, the characteristics of the pain, the location of the pain, and the duration of the pain. So everything is there, put it in the first paragraph, first sentence itself. Now, why we are writing about the below-table masses is that because of the pain, the second step is that we have to say where the pain is. So we need to palpate. So we palpated, we had identified below-table masses on her both flanks. Now, her second problem after pain was macroscopic hematuria. So this is the second thing. So we have done some blood examinations then. Based on the initial assessment, a series of blood examinations were performed. So initial assessment, we have seen a lot of assessments were there. We are not mentioning all these things there. So a series of blood examinations, we have hemoglobin, platelet, urea, creatinine, albumin, a series of blood investigations were performed, which reveal higher levels of blood, urea, and creatinine. So I don't need the word blood to be repeated twice. So that's it. So we have written the levels of urea and creatinine in brackets. So very carefully placed with the word respectively. In addition, protein and blood traces were there in her urine. So apart from the blood abnormalities, that is urea and creatinine higher levels, we have the presence of protein and blood in her urine. Her vitals were stable except a high blood pressure. So her vitals were stable except a high blood pressure. So the blood pressure was this thing. Now we are passing on to the second paragraph. Since Mrs. Austin's X-ray showed no confirmatory diagnosis, and she has a family history consistent with an autosomal dominant trait, an abdominal ultrasound was performed. So why an abdominal ultrasound was performed? The reason why I performed the abdominal ultrasound is she had an X-ray. She had blood investigations done. So we found urea creatinine higher. She had urine analysis and urine microscopy done. We have seen the presence of protein and blood in her urine. So we have done X-ray, and X-ray didn't show any any calcification or something like that. So we didn't have any confirmatory diagnosis right now. Apart from that, we have information that her family history, her family has some problems. So autosomal dominant trait. So we have these things in mind. So what we have to do is that to confirm the diagnosis, for this reason, we have done an ultrasound abdomen, and this revealed typical appearance of multiple cysts surrounded by thickened walls on each kidney. So we have diagnosed the disease, that is polycystic kidney disease. Therefore, vasopressin receptor antagonists were commenced on her on a trial basis, and she has been referred to you. So this is the paragraph here. Now, once the ultrasound confirmed her diagnosis, We started vasopressin receptor antagonist, which inhibits the growth of the cysts. And she was immediately referred to you for a long-term care. It would be appreciated if you could take over Miss Austin's further management and report the outcome in order to plan her future therapies. The future therapies are included, say here, it is renal replacement therapy. So we have now confirmation whether to carry on with this renal replacement therapy or not. This is an anticipation, it's a plan. So it is based on the outcome. We decide whether to outcome of the treatment. So when there is a long-term treatment, so we have started medication, we have other types of treatment, so that will be following. So if she is progressing well, then there is no problem. If she is not progressing, so she needs replacement therapy, means we have to give. So there will be future therapies. So in order to plan her future therapies, the outcome of the treatment is very much necessary, and that is what we have written in the first sentence in the last paragraph. It would be appreciated if you could take over Mrs. Austin's further management and report the outcome in order to plan her future therapies. Please make her aware of the importance of maintaining her diastolic blood pressure under 85. So what is the reason? If it is more than 85, you be having the problems of the cyst persistent. So it won't be that the pressure will be high, and this is quite dangerous in case of this polycystic kidney disease. So it's very important to maintain a diastolic pressure under 85. So this is what we need to inform her. So I have to inform her too. I also have to make measures to maintain her blood pressure in the level. If you have any further queries regarding Ms. Austin's condition, please do not hesitate to contact me. Your sincerely registered nurse emergency department. So that is the end of the explanation here. It's a bit complicated. So except in the purpose paragraph, rest everything may be understandable for you. I leave the purpose paragraph for you. I think you are better writers than me and my students. So just try. Thank you. So meet you with another letter, hopefully soon. Thank you.